Welcome back. Moderna now looking to create a dual vaccine to fight COVID-19 and the flu. Fox News medical contributor Dr. Janette Nesheiwat calls this development unbeatable, and she joins me now to explain why. Good morning. Good to see you.
Hey, good morning,
Good morning.
Jillian.
So when we first started the conversation about vaccines, a lot of us were wondering if at some point the COVID-19 vaccine would be in with the flu vaccine, and it looks like that's what could potentially happen.
Yes, they say about 1 or 2 years it could possibly be on the market. Of course, it has to get FDA approval, but this is really incredible because, both flu and COVID are respiratory illnesses, and it makes sense to combine the two of them and have it as a 2-in-1 vaccine, like we see, for example, measles, mumps, and rubella vaccine, or the tetanus, diphtheria, pertussis vaccine. So it's common to combine vaccines together, and fortunately, about 200 million Americans every year get their flu shot. So maybe they'll be more likely to get their flu and COVID shot together. And what does that mean? Saving lives and less hospitalizations.
Now, this might be a dumb question, but I'm not a medical expert, so I don't know. You would. When you combine them, does that lower the effectiveness of either?
Very good question. Remember, they're using mRNA technology for the COVID vaccine, so we're going to make sure that the efficacy of the COVID vaccine stays high. And the beauty of this technology is that we can modify it based on the change in the virus, based on variants. And then we need to continue to work on strengthening the efficacy of the flu vaccine. Usually the flu vaccine is anywhere from about 30 to 60% effective, not nearly as strong as the COVID vaccine. But hopefully with this new technology, we can strengthen the efficacy of both the influenza vaccine and the COVID vaccine.
That'll be great. Now, let's look at these numbers. And I've got to, I'm kind of speechless looking at them. But flu cases from last year to this year, as you can see, look at this. A little more than 1,800 in 2020-2021 flu season. Is that right? Compared to 38 million the year before?
Yes. Unbelievable. The 2019-2020 flu season, nearly 40 million cases and also 400,000 hospitalizations. And that number decreased dramatically, most likely because of the combination of the flu shot and also the preventative measures we used for COVID worked against influenza as well. That's hand washing, wearing your mask, social distancing. So if we can continue that up, hopefully we can get rid of or put to rest these outbreaks of both flu and COVID virus as well, the two of them.
It's just wild to me because it makes you wonder why flu cases are down so low and we're doing all these mitigating measures to social distance and stuff, but COVID numbers are still kind of insane. Okay, so let's go ahead and talk about Easter here real quick because the CDC releases guidelines for Easter and Passover. We can pull them up on the screen here that you can visit with other fully vaccinated people indoors without wearing masks or social distancing. You can visit with unvaccinated people indoors from one household who are at low risk without wearing masks or social distancing, can refrain from quarantine and testing following a known exposure if asymptomatic. That, again, is guidelines for fully vaccinated Americans, of which 14% of Americans are fully immunized from COVID-19. What do you make of these guidelines?
Yes, so from my experience, the outbreaks that I've seen had to do with social gatherings. We saw that at during the holidays, and there's a concern that we might see it again with the Easter holidays that are coming up with Passover. So we want to be careful, but you can go see your family. The key is not visiting a household that has a mixture of households. It's okay if you are vaccinated. For example, if you're a grandparent and you want to go see, and you're fully vaccinated, and you want to go see your unvaccinated daughter and her children, that's okay if they are unvaccinated, as long as it's just them and as long as they're at low risk. That's the key. Low risk, and there's no other mixing of households. It is still recommended, though, if you are going outdoors in public around other people, around crowds, gotta wear your mask even if you're vaccinated, because the vaccines, they are not 100% effective. And like you mentioned earlier, we only have about 14% of Americans who are vaccinated. And for example, Johnson & Johnson, a great vaccine, but only 72% effective. That means you have nearly a 30% chance of still picking it up and spreading it to others who may be at high risk of COVID complications and have not yet had the chance to be vaccinated or afraid to be vaccinated for whatever reasons. So that's why it's still important to take precautions, be safe, be smart, protect yourself, know your risk, at least until we get a lot more Americans vaccinated, which we are on the way to doing that with 2.5 million vaccines daily.
Can I get your opinion on this? I saw saw this when I was coming into work this morning, and I didn't quite know what to make of it. Apparently, researchers are studying these masks that just cover your nose and not your mouth, so that when you're at restaurants, you can at least stay a little bit protected. What are your thoughts as a medical expert?
Okay, so the virus can enter your eyes, your nose, and your mouth, but obviously you have to take off your mask when you are eating. So I would say it's okay to wear it if you want as maximum amount of protection as necessary. But when you're finished eating, cover back up again, because we don't want you at risk.
I know. It's just, I don't know. I don't know what to say about it. Dr. Nesheiwat, thank you.
I wouldn't wear it. I would just eat and then put on my regular mask.
Right, because you don't want people forgetting to cover their mouth in. All right, thank you,
That's
doctor.
Right.